Okay, we've got some urgent news coming out of India. The country is on high alert. Why? Because suspected cases of the deadly Nipah virus have just been detected, this time in West Bengal. It's already putting national outbreak response teams into motion.
Right, you're probably asking yourself a ton of questions. How serious is this really? How does this thing even spread? And maybe the biggest one, how worried should we be? Well, in this explainer, we're going to break all of that down. We'll look at what's happening on the ground, what this virus actually is, and why a super fast response is just so critical. All right, so let's get straight to the facts. Here's what we know. On January 11th, 2026, two suspected cases of Nipah popped up in West Bengal. And listen, this wasn't just a hunch or a preliminary guess. The alarm was officially sounded because of definitive lab tests that came back from the ICMR-linked facility at AIMS Kalyani. That's a serious confirmation. Okay, so let's really dig into how this whole situation unfolded. What were the first signs, who was affected? This is the story of how that initial alert got triggered. So the first patients, they're two nurses from a hospital in the Barasat area. They were rushed to a private facility and put under really strict isolation protocols, which, is exactly what you have to do in these situations. And the reports coming out say their conditions are critical. That right there tells you just how dangerous this virus can be from the get-go. So with a situation like this escalating so quickly, the response has to be immediate. And it was. Right after this news broke, the government of India didn't waste a second. They deployed a national team of experts to get on the ground and support the state authorities. And we're not talking about just any team here. This is the A team. We've got top experts from the National Institute of Virology, the National Institute of Epidemiology, AIMS Kalyani. They even brought in wildlife experts from the Ministry of Environment. It's this kind of multi-pronged approach that's absolutely crucial. So what's their game plan? Well, it's really methodical with 4 key steps. First up, confirm the diagnosis. Make it 100% certain. Second, and this is so important, start the painstaking work of contact tracing. That means finding every single person who might have been exposed. Third, they're going to ramp up surveillance in the whole area to catch any other potential cases super early. And fourth, they're beefing up infection control in all the hospitals and clinics to stop it from spreading any further.
All of this incredibly rapid action, it's all because of what this virus is. So to really get why the response is so urgent, we need to take a closer look at what we're actually up against. So what exactly is the Nipah virus? Okay, so Nipah, or Neve as it's called, is what's known as a zoonotic virus. Now, that might sound technical, but it's a really key concept. All it means is that it's a virus that jumps from animals to people. And in this case, the natural carrier, the animal that has it but doesn't get sick from it, is the fruit bat. And believe it or not, this virus isn't new. It was actually first identified way back in 1998 during an outbreak in Malaysia. Since then, it's become this known, recurring public health threat in this part of the world. Which, of course, brings us right back to the situation we're seeing in West Bengal today. Now, here's where it gets really important for everyone to understand how it spreads. There are basically 3 main ways. First, from animals to humans. We're talking bats or pigs or even just contaminated food. Second, it can spread directly from person to person through things like respiratory droplets or bodily fluids. And third, and this is critical, it can spread like wildfire in healthcare settings if infection control isn't absolutely perfect. That's why the fact that the first 2 patients are nurses is such a major red flag.
The tricky thing about a Nipah infection is how it starts. At first, it can look just like a bad case of the flu. Fever, headache, muscle aches. But the real danger with Nipah is how fast it can escalate. It can progress to something really severe. Inflammation of the brain, which is called encephalitis, and that can lead to confusion, seizures, and even a coma.
Yeah, that rapid and severe progression is exactly why this virus is so feared. So let's get to the heart of it all. Why do health officials take this threat so seriously? What are the real stakes here? And this leads to the #1 question on everyone's mind. Can we treat it? Is there a magic bullet, a cure, or even a vaccine that can stop it in its tracks? And the answer, unfortunately, is a blunt no. Right now, as we speak, there is no specific cure, no targeted antiviral drug for Nipah, and there's no approved vaccine to prevent it either. So here's what that means on the front lines. Medical care for Nipah is what we call supportive care.
Basically, doctors can do their best to manage the symptoms, control the fever, help with seizures, provide oxygen, but they don't have a weapon to actually go in and attack the virus itself. And this really drives home the danger. In past outbreaks, the fatality rate for Nipah has been somewhere between a terrifying 40% and 75%. Think about that. That incredibly high number is a direct result of that severe brain inflammation we just talked about. Without a direct cure, it's just so difficult to stop that progression. And that's why preventing the spread is literally everything. And look, this isn't just a local or regional concern. Global health agencies have a special name for viruses like this. They call it a priority pathogen. That's not a term they throw around lightly. It's a formal label for diseases that pose a massive public health risk because they have the potential to explode into a full-blown epidemic.
Okay, so given this really high level of threat, what does it all mean for you, for the public? Let's break down the official guidance, which is sending a very clear message. This is a time for vigilance, not for panic.
The message coming from health authorities is really clear and firm on this. They're saying, look, there is no need to panic right now, but this is a time for vigilance. Hospitals are on high alert, and the public is being urged to just follow the official health updates. In any kind of outbreak, cooperation and good, clear information are always our most powerful tool. When you step back, this whole situation is a really powerful reminder of a modern reality. Our best defense against these emerging diseases, it isn't always some miracle cure that we might not even have. It's having strong surveillance systems that can spot a threat early, having well-trained healthcare workers on the front lines, and having a government that can take decisive, early action. The response we're seeing in West Bengal seems swift, it seems comprehensive, and that's a real testament to the lessons we've all learned over the past few years. But it does leave us with a huge, lingering question. As these kinds of global health threats continue to emerge, and they will, are our early warning systems, our ability to respond, truly strong enough to keep all of us safe in the long run?